By the end of today's presentation, you'll all be able to describe and understand a bit about what trauma is, what trauma-informed care is, and certain trauma-informed care approaches to practice. I hope that you're able to recognize some general signs and symptoms of what trauma is and how it can present, and then also be able to have some pretty fruitful discussions about how trauma-informed care can impact the client experience, specifically as it relates to coaching. And then discuss a little bit about trauma-informed care as it applies to coaching, maybe share some of our own experiences. We discuss about how we can continue to implement it in future practice. Before we get started, I'd like to know what your understanding currently is of trauma, about what it is, like what you maybe already know about it.
I would say like trauma is the result of like an experience that maybe was like very negative or like negatively impactful in a way, if that makes sense.
Yeah, absolutely. So negatively impactful experience.
And I feel like trauma can happen at any stage in life. So not necessarily any age, but also like adulthood, young adulthood, whatever that is. And it can also be like impacted by so much. I know you already have it on the screen, but like environmental, behavioral, stuff like that, even relationships with people, like anything I feel like can cause like trauma, I guess.
Yeah, absolutely.
Yeah, it's interesting. You asking this question makes me realize that even though I feel like I can recognize signs of trauma, I don't really have a working definition of it. But kind of like what you guys are saying, an individual's interpretation or experience where they no longer felt safe.
Yeah, absolutely. I like how you said it, right? Like it's like an individual experience.
Yeah, because what could be traumatizing for one person could be like, I mean, a little bit uncomfortable for another.
Exactly. That's what I think makes it like so hard to define in a way, because it's so like individual and so different for every single person who experiences it. So it makes it like, even though we have this idea of what it is, it's like when you actually think about defining it, each person would probably define it differently in their own way.
Yeah, absolutely. Yeah. These are really great insights. Thank you all for sharing. So there are 3 types of traumas. One is acute, where it's an isolated one-time experience. There's also chronic trauma, which is more of a prolonged experience, and complex, which is a series of experiences, right? They all result in adverse effects on our functioning, mental, physical, emotional, even spiritual well-being. It's something that I found along in some readings. And all 3 of these experiences. Do you have something, Kate?
I have a question.
Yeah.
So you said there was acute, prolonged, and complex?
Yes.
So what's the difference between complex and prolonged? Because the way that you're describing it, I feel like I can't separate the two.
That's definitely like, I feel like more of a specific example. I think chronic might be like a series of specific, more like acute events that are continuing to happen. And it might be like one event, like one specific event over time, where complex is multiple things happening instead of just like one thing. So it might be more than one thing that's happening. And so in that sense, it becomes complex. But I think that's a good question in terms of like whether complex trauma can be acute or it can be chronic. So all 3 of those can contribute to what we know as PTSD, as post-traumatic stress disorder. And that's a longer term condition where somebody experiences flashbacks and re-traumatization of an event, and their reaction, their body's nervous system reaction to specific events that are triggering can be perceived as a threat. And it's essentially our way for survivors of PTSD, of trauma, it's their way and of their bodies to alert them of a potential threat and to protect them. And so the way that our brain interprets all traumatic events is either as something that happens too much too soon or too little too late, where there's not enough of something good, like neglect. And we'll get a little bit into some examples in the upcoming slides. And overall, trauma can be explained as a persistent dysregulation of our nervous system, and that it impacts our bodies and our brains in ways that distorts how we perceive and experience certain events around us and how we react to the world around us as well. So the Substance Abuse Mental Health Service Administration defines trauma through the 3 E's. where there is an event or multiple events that cause trauma. An individual's experience of the event determines whether it's traumatic or not. And the effects of trauma include the adverse consequences that we discussed before, and those can lead to a fragmentation of the coherence of experiences. So this image on the right is a nice image of, it's called the elements of consciousness, and it's just one model that kind of explains a bit about how our bodies perceive traumatic experience. And there's multiple different images, but this is just one as a whole. So it goes to show that sensations can become separate from images, images can become separate from affect. And so it shows that fragmentation that could occur as a result of a traumatic experience, and how our body perceives certain events and the result of trauma. And so this is why when people attempt to recount their experiences, they frequently only remember certain parts of it or portions, as opposed to the entire sensation, affect, meaning, behavior, images behind a specific experience. And then just a little bit of background: in the 1980s is when the DSM, or the Diagnostic and Statistical Manual of Mental Disorders, recognized trauma as an official diagnosis or as a significant event that could have potential long-standing implications for occupational functioning. So these are some examples of what we may commonly recognize as traumatic, where it could be abuse initially. When I think about traumas, neglect, illnesses, or access to healthcare, whether or not you have it, food insecurity, violence, the propensity to be in an area where you are maybe more prone to getting natural disasters and certain things happen as a result. Geographical displacement, something that we're seeing right now, where people are forced to leave their countries, become refugees, or simply immigration to a different country, can be pretty traumatic. And also motor vehicle accidents. Let's see, before we continue, because the next slide talks a little bit about this, what are some signs or symptoms that you observed in the past from your previous experiences about how trauma can present itself, either emotionally, psychologically, physically?
I know like a common response to trauma, you kind of touched on this before, in the way where it's like you cannot really like remember specific events of what happened, but like the idea of dissociating, like whenever something comes up that's like triggering to that trauma, that's really common. So that's kind of like the out of body feeling of like not being in touch with like your emotions or like connected to your body to feel like safe and escape like the trigger.
Right. Maybe like dissociating, withdrawing socially. Yeah.
I think a big one, whenever people have told me stories that are traumatic, is like them not being able to recount the event until like a long time afterwards, like having known them for a while. And this is probably like more of a sign of like healing from trauma, but it taking like a long time to kind of like make sense of the narrative that they have.
Yeah. Absolutely. So like maybe taking a bit of time to process certain events after.
Yeah. And I think not even realizing, I think sometimes people don't even realize in the moment that something was traumatic to them.
Right.
So almost like it seems like a little bit of like a minimizing response. It seems almost like it could be potentially like a trauma response.
Yeah. Yeah. Maybe like disregarding an event or something because maybe you haven't really thought about the effects it's had on you. And then over a period of time, you realize, hey, like maybe that wasn't such a great thing that happened to me. Thank you all for sharing. Right. So recognizing signs and symptoms, this very pretty graphic was made by an occupational therapist who names Taylor Millsap. She really studies, her life's work is about childhood and childhood adverse events and really tackling trauma as it applies to children. And I think a lot of the research that I came across in creating this presentation definitely lies in adverse childhood effects or experiences rather, that kind of form and shape who we are. And so this graphic does a nice job of not completely focusing on childhood experiences, but just making it more applicable to everyone's experiences. It takes it out that way of looking at things, so to speak. So certain potential deficits that we may see can present themselves in socially, emotionally, as you stated, Carrie, a lot of like maybe dissociation or withdrawing. So having to do with like maybe emotional regulation, the way that we socially interact with our environment, our peers. It could be sensory. It could be a sense of self-control, how we perceive ourselves, comparing ourselves to others, setting personal boundaries, whether we perceive them as being healthy or not, trusting folks. And trust has a whole variety of different meanings, right? And the last one, neurological and cognitive effects as well. So we're going to get a bit into that. Has anybody seen this image before? Right, so before we get into it, I want to ask if anybody knows the difference between trauma versus stress.
I feel like stress is something that is normal that you can downshift back into normal regulation, right? Whereas trauma is something that is disruptive. Like if you can't shift normally back into like rest and digest, then like that would be a potentially traumatic event. Whereas like stress, oh, we have like a deadline and that adds extra pressure and maybe it's uncomfortable, but it's not something where you feel like you're actively in danger.
That's interesting that you phrase it that way. It seems almost like your perception or understanding of stress is in the way that we are able to overcome it or able to work through it. Maybe a little bit, I don't want to say easier, but maybe we have certain resources to overcome it or create a certain plan to get over it really quickly, to problem solve through it, whereas trauma might take a little bit more work.
Yeah, and I think stress is not inherently bad. I think too much stress is like not great, but a certain amount of stress is like healthy and normal, whereas like trauma is whenever it shifts into like unhealthy and not normal.
Yeah, perfect. That's definitely the key differences. Is that not all stress is bad stress. It could be positive, it could be negative, it could be tolerable, it could be toxic, right? But trauma is definitely rooted in like negative and adverse consequences, right? So stress is that feeling of becoming emotionally flooded or feelings of intensity in regards to emotional or physical tension within your body. And it's a result of maybe like an event or maybe like thoughts that you have, and it is definitely an individualized response. It definitely depends on a person's perception of their experiences. So this kind of goes back to trauma too, where traumatic events can definitely be stressful, and they're not necessarily like exclusive of one another, but it definitely depends on how the person perceives it based on their individual experiences. And so getting to this very interesting visual, it is, if anybody's heard of the zones of arousal. So this green zone, or it looks a little bit blue to me, represents a window of tolerance where whatever event that you're going through is tolerable, right? And then this red zone here represents feelings of maybe being overwhelmed or hyper aroused within the nervous system and maybe beyond our threshold for tolerance. We're gonna get a little bit more into that too. This is a pretty busy slide. So I want you guys to take a few seconds, maybe even a minute or so, to take a look at both visuals, and you can kind of like nod your heads and when you feel like you've processed enough of it. All good? Okay, cool. The reason why I like the one on the left is because it has a description of what performance looks like depending on your emotional arousal state. And it shows a zone of optimal functioning where you need a happy amount or a good amount, moderate amount of arousal, where it's not too low or too high to stay engaged and to perform at an optimal level in terms of moderate arousal. And then the x-axis with performance, it depicts whether or not how your performance is, like if it's poor, if it's good. And we see that in a moderate state of arousal, you tend to have good performance. When it's too low, your performance might not be good. You might not be performing to the way that you want to be. When you're over aroused, you might also be performing very poorly. You might be in that overly stressed spot. This gives you a nice visual about like that sweet spot of where we are or where we hope to be like in everyday life. And then the visual on the left just kind of gives a little bit more concrete examples about what would happen in states of being hyper aroused or maybe hypo aroused. And this is here in the middle, the zone of optimal arousal. And so does anybody know kind of what happens to our bodies when they're in overdrive?
Fast heartbeat, like it's like that fight or flight response.
Yeah, absolutely. Yeah, or we're hyper aroused, our heartbeats are really high, our minds are racing, start sweating, stress hormones, right? Perhaps there's that fight or flight. What happens when our bodies or our nervous systems are experiencing a nervous lag or a shutdown? What's the opposite of what you just said?
Yeah, I just feel like that's like shutting down.
Right. Yeah, so it's that state of hypoarousal, where we freeze or submit, right? And that's the response that's elicited. So you have a good understanding about like what happens to our bodies when we're hypoaroused in regards to this topic. And so trauma really occurs when the peak of the arousal cycle, when it's above our threshold for tolerance, so meaning we're no longer in that sweet spot of what we can tolerate. And when this happens, different aspects of our realities begin to fragment and disconnect from one another. And that's when that traumatic experience occurs. And so this is the way that it works. So our brain becomes hyper-focused on the trigger, scanning the environment for anything that reminds us of past traumas. And then because the brain is so focused on that negative stimuli, everything starts to feel super dangerous. We're on high alert, and things that maybe felt safe before no longer feel safe and become threats. And so as this perception of threat increases, our brain specifically our amygdalas, they go into overdrive, and we become really hypersensitive to certain things around us. And so every time that alarm goes off, that automatic process goes on, Carrie, that you mentioned so nicely, where our brainstem tells our bodies it's survival mode. Our heart rate goes up, stress hormones, cortisol increases, our breathing rates increase, and then depending on what our survival response, so to speak, is, we either go into that fight or flight mode or that submission or freeze mode. So what is trauma-informed care? Anybody want to take a guess at what it might be, or maybe like if you want to share a little bit about your understanding about what it is already?
A huge piece of it too is like besides what's listed on the screen, but more like this idea of like meeting the client where they're at, and not pushing them one way or another, but truly just like sitting with them where they are, where they're presenting, and kind of just like being that neutral support, I guess.
I think a big thing that I think about in terms of trauma-informed care is like what it says on the slide about safety and creating a space that is safe for the client. And for example, it's one thing to say, this is a safe space, but to actually demonstrate that in practice. So for example, showing consistently that you respect, gender identity and sexual orientation and culture. So just making sure, and even the client's like individual experience, if it might be different from yours. So yeah, kind of building off of what you said, Danielle.
Yeah, definitely recognizing and being respectful of who our clients are and taking them for who they are, or accepting them for who they are, for sure. Yeah, so right, it's trauma-informed care approaches. They're definitely strengths-based in nature. What we practice in coaching every day describes the ways that we as providers provide that safety in multiple settings beyond coaching, whether it's in healthcare, education, anywhere else. It's not just like formed around maybe the medical or health model. And it serves to better serve our clients and our participants, patients who have experienced all life events. And we assume the notion that a vast majority of people have experienced or potentially experienced some sort of trauma in their lives. And it's an approach that we take on in anticipation of avoiding re-triggering or delving too deeply into topics that are sensitive. We do emphasize client safety and participation to give back patients their autonomy and control, which is really important, as we know, right? And we create these empowering environments that give back to our clients. So these are some of the core principles that the ones that I mentioned earlier, that they really just emphasize in trauma-informed care approaches is safety, creating a trustworthy and transparent environment, providing supports and mutual self-help, collaborating with our clients, and empowering them, giving them back a voice, giving them choices, and being respectful of cultural, historical, and gender differences. How might trauma maybe affect or impact the clients that we treat today? Why does it matter?
I think a word that comes to mind for me about why it's important is compliance, and how in healthcare we use this term of like non-compliant, but what does that actually mean, right?
Yeah.
That means nothing.
Right.
Just, it just means that the client, for whatever reason, isn't able to follow through on recommendations. And realistically, I think that means that like you're not able to help facilitate this client's healing. So I think really the reason why we care is because if you're not respecting someone's trauma, someone's experience, then you're not going to be able to help them move towards, a more whole version of themselves.
Yeah, absolutely.
I feel like there's so many reasons to support like why does it matter, but I think a few that come to mind is like just that like client rapport too, like it's so important to like honor where the client is, especially like with what their experiences are, in order to like maintain that relationship, so that you can foster this environment where like growth can happen, especially like in these coaching sessions. Like you never want to be in a place where you're like re-triggering a client and like sacrificing that relationship.
Yeah, what I'm hearing both of you say is that like fostering that relationship is super important, and doing everything that you can to make sure that you're providing that safe space for them, so they know that you're a trustworthy clinician, right? And that they can utilize your services in a way that feels comfortable for them. So in some of like my research doing this, I came across, and I guess something that might be implied, we don't often talk about it, but and you guys kind of hinted at it, is like if we don't offer these safe environments for our clients, then people are going to be reluctant to come to us in the future, or come to us at all, right? And it might prevent them from getting the care that they need. And even if they might be coming and they don't necessarily trust us, maybe they're not disclosing certain things that are important and could be important to address, to provide the best care for them, or to collaborate most effectively with them, right? So it's definitely about building that trust and promoting our clients' independence and autonomy and control, right? It definitely like goes back to how they engage with us, for sure. Okay. So moving a little bit deeper into that, there are certain ways, right, that trauma can affect occupational performance. So bringing it kind of back to coaching, and how, right, coaching that we focus in on is based on promoting that occupational functioning. What are some ways that you think maybe occupational performance is affected by previous adverse experiences? So thinking like ADLs, like education, leisure, work, social participation.
I feel like all areas of occupation can be impacted if there's any sense of trauma. Yeah.
Yeah, and I think it can be like, I agree with Danielle that it's definitely like all areas of occupation, and I feel like it can be harder to like set the goals for yourself and then also reach them too. So it's like kind of every single aspect of that can kind of be affected overall, and just like make it more difficult.
Yeah, it's like forward planning and creating plans and thinking through maybe problem solving, right?
Yeah, this kind of reminds me of one of the lessons that Ashley taught us, and I think it was self-determination theory, but I'm honestly not 100% sure. But it was the one about being able to plan towards the future and like create goals that you can execute. And like if you've had a trauma response with something, yeah, kind of like what all of you guys are saying, like if you can't imagine a better future, then you can't even start working towards that.
Yeah, exactly. Right. So like the ability to like look ahead can definitely be hindered. These are just some specific examples of what maybe can be affected. And truly, Danielle, like anything and everything, right? Every occupation, like decreased motivation to engage in everyday activities. Right? Our executive function that you guys talked about is like the ability to look into our future and maybe plan ahead, or envisioning a future might be difficult. Sleep is definitely like a huge one that I think we've seen in some of our clients, like difficulty falling asleep or staying asleep, and how we interact in our social environments too, like feeling isolated or not having certain opportunities in the past, like lacking opportunities have maybe affected the way that we interact with others currently as a result, like having like poor interpersonal skills or maybe even boundaries, or maybe even like having an overactive stress response. What are some coaching approaches that we already use within our program that kind of come to mind, maybe more specifically? Or like what are some ways that you guys think that we kind of uphold those trauma-informed care approaches in our practice?
I think like overall with coaching, like the level of like meeting the client where they're at is something that like definitely helps with trauma informed care. And even like specifically in terms of like giving positive affirmations, it's like you're not going to go like above and beyond if a client is like down here talking about something that's like super low and super hard. Like you're going to meet them where they are, but still have to try to put a little bit of a positive spin on it.
Mm-hmm.
I think the way that we kind of like what you're saying, Carrie, about meeting clients where they're at, I think the way that we allow clients to define their own goals is very trauma informed. And then we kind of like scaffold towards meeting those, because I think sometimes if, someone doesn't have the experience, an OT or, a therapist or whoever might set a goal that's like beyond the client's comfort or ability. And so by allowing the client to decide on their own goals, we're meeting them where they are. And I think that also bolsters client autonomy. And in general, a traumatic experience is one where like you lose autonomy. You are no longer in control of yourself and your surroundings and your environment.
Definitely giving our clients back autonomy by allowing them to make their own choices and making their own decisions, right? That's definitely one of like the core tenets of coaching, right? Is like the client is the driver of the session. And I think it really serves to this approach for sure. Thank you. Something that comes to mind too is like giving people predictability that comes with the coaching model, that like maybe over time they kind of get into the swing of things, they get a little bit more comfortable with like what to expect. And so that aspect of coming into a service where they might be new can be a little bit scary in the beginning, and then over time they start to understand or get to know you. They start to understand the process, what they're maybe getting out of the process, and it becomes almost, even though they work on different things every day or every time they come in, it's still a bit predictable. And so it takes that scary part out of it, where in some instances they've been in situations where things can be a little unpredictable. So I think that kind of also contributes to the way that we uphold some of these approaches. And then collaborating with the client and allowing them to decide on their goals and make the choices for themselves, but also like collaborating with them. And Carrie, you mentioned like affirming them and their strengths. And so I feel like that all together also contributes to them just really just excelling as a result of what we do. So these are some responses that I thought that we already do, or we definitely do, just like continued list, right? So actively listening, speaking calmly and respectfully. I think that also kind of goes to maybe meeting the client where they're at, where if somebody comes in very high energy or super jazzed about getting an A or B on their midterm, where right, or an improved grade on their midterm where they were maybe failing a class, you try to right pump them up and affirm them and affirm what they've done. So that's the opposite maybe of speaking calmly, right? But it's just kind of meeting them where they're at. And then on the opposite side of the spectrum is like if somebody comes in super down, right? You maybe like lower your tone of voice and speak to them a little bit more calmly, be having like more of like an open body language to something that's like very inviting and welcoming and warm. We mentioned using affirmations. This maybe can be a form of validating or validation, but also maybe validating certain experiences and maybe not being dismissive of what certain clients come in and say, and right, acknowledging what they've said, leaving space for silence, really appreciating silence. Sometimes it can be really difficult to want to jump in and fill that awkward silence, but sometimes it's really important for us and our clients to really process kind of like what's going on and really think through certain things. And that kind of goes along with providing that personal space. Kate, you mentioned offering choices, maybe taking deep breaths. Sometimes we've done that with clients too, right? Where things can be really overwhelming. What we do is, right, and in collaborating with our clients is really allowing them to meet their goals. And sometimes their goals when they come in maybe seem unattainable and they could be really overwhelming to think through. So maybe taking a deep breath is maybe helpful. And then practicing self-care, the promotion of that in certain clients that come in, just promoting that. Sometimes I think of clients who want to come in and have maybe more of an occupational balance. And part of that occupational balance is in self-care. Listening without judgment, using reflections, having awareness of what's spoken and what's unspoken. I think we're really good judges of maybe something else is going on. Maybe you came in with a focus today, but that's not really your focus, or that's not really what's on your mind. Like, what's actually on your mind? And then considering maybe past experiences or present situations, being considerate of that. Has anybody heard of trauma stewardship? So trauma stewardship is essentially, it's specifically related to vicarious trauma. Has anybody heard of vicarious trauma? So trauma stewardship is essentially involving the care of collaborating with patients and clients. It's specifically to like the health model. It's where we will collaborate and work with the client in a way that also allows us to acknowledge our own struggles and how much of a load we're taking on in order to prevent us from taking on that emotional load or that traumatic load. And that kind of brings me to the vicarious trauma that is experienced as a result of working very closely to clients who maybe have disclosed some information with us that might be triggering. And it often comes from working closely, like empathetically with them too. And so essentially, trauma stewardship is a way of preventing burnout, preventing our own traumatization through our experiences. And this can involve reflecting on our experiences, maybe like after the end of the day, after a client session, is taking a step back of maybe like you talked about something like maybe really heavy, or maybe something that made you think about something that happened in the past or your present that might be uncomfortable, right, to think about, and you're reflecting on your experiences after, and maybe how they might influence your interactions with your clients in the future, and maybe recognizing that maybe there is some burnout and prioritizing, again, like your own self-care, maybe taking breaks from that client, maybe balancing a caseload that is a little bit more diverse and taking breaks throughout sessions. In addition to that, maybe seeking social supports and other types of engaging in hobbies that might be fun for us, right? So just kind of a way to avoid that emotional burnout. And then we're going to end with a case study. So I'd like for you guys to take the time to read, so you can kind of skim through and let me know once you're done reading. I'm going to add a little bit onto the prompt. All good. So I want you to consider this is your first time meeting George, and he's now in college. He's at the Gold Squared program. He's a freshman. He's a health studies major, and he's really interested in doing well in school, meeting new friends, forming really strong relationships and with his friends and his professors, and getting a summer internship. A lot on his mind. He's very eager to succeed. He wants to do his best. Part of the reason why he's coming to Gold Squared is because he's finding it challenging to build those social relationships, especially with his professors. He happens to disclose the story in your first session with him. Using a coaching approach, how would you respond to maybe some of his concerns, and what are some things that you would maybe say to him based off of what he's disclosed to you and what his goals are?
Reading through this case study, I feel like it's kind of sad because I don't feel like this is uncommon, unfortunately, to have like this behavioral response and then have it be treated as like, now you're being punished for this response that you had, without actually, meeting it as with a trauma-informed lens, I guess. But But yeah, I guess if like George walked into a goal squared session, a lot of it would just be like obviously meeting him where he's at, like holding that space for him after he shares that story, and then somehow like, you know, supporting his goal of wanting to kind of like supporting where he's at with making these social goals. And I guess it's important to understand how he defines those social relationships, because as he defines different from maybe how we respond to them, you know, not having gone through this trauma and stuff.
Yeah, it totally does, right? Is seeing like what his personal goals are around building those social relationships with his professors, and right, and what that means to him specifically, because we might have our own ideas about what that means, but asking him truly like what he wants to get out of it.
Yeah, I feel like a big thing, a really gentle balance that like I feel like would be a bit challenging as a coach is, right, we want to affirm what has happened to him, but not necessarily focus on it, like focus more towards the future. So I think if I were in this situation, I would try to be really mindful of affirming his experience. And I probably wouldn't even really try to put a positive spin on it, because I feel like that can be like toxic positivity. But helping him stay focused on the future and what his goals are, like both of you said, and making space for him to explore things that feel safe. So like reminding him of time, or maybe a lot of problem solving around like, oh, when has this gone well for you? To kind of work on those neurological pathways, right? Yeah, I feel like safety would be like a huge theme for working with someone.
Yeah, definitely acknowledging what he said and not being dismissive of his concerns, because they're totally valid, but maybe not staying on that one topic and not continuously talking about it, but maybe focusing in on, right, what his actual goals are, and really affirming his strengths with maybe asking him what has worked in the past for you, and how can we allow you to do more of that so that it could work towards your advantage. Yeah. Thank you. Breathe and reflect. Some of the questions that I thought about that would be a nice way to end the presentation. I was just kind of like understanding maybe how your thoughts have changed, maybe what you're going to do more or less of in the future, or what you really love that you're doing now that you found has worked for you, and you're just going to continue to do that because it's working, or maybe what you're not going to do. And then you don't have to dive into the third one, but that's also a good conversation starter for future presentations.
Yeah, I feel like every time like we have like a trauma or trauma informed care presentation, like I learn more each time, which is really helpful. And I also feel like it's really helpful to like continue kind of to have these conversations, because I feel like sometimes like, and even in terms of what I will do more in the future, is just like remind myself to kind of always have that in the back of my head when treating patients, because I feel like sometimes it's so easy to like forget about that and like kind of just like not really think about it. So keeping that in the back of your mind and like having it kind of be like refreshed in like presentations like this, I think is really helpful.
Yeah, definitely just like a little reminder every now and then of like, even though you didn't go through certain experiences, just being really mindful of maybe other people have, and just being sensitive to that.
Yeah, exactly. And I feel like in like the goal squared setting, like it definitely is in the back of our mind more, but like whenever we move on to like different settings that aren't necessarily like mental health, like making sure though that still is in the back of your mind, because like anyone can have trauma even if they're not receiving services for mental health from you.
Yeah, absolutely. And I feel like this is very like on brand right now for your time transitioning out of your field work, is like you're moving on into a different setting where, right, it's not a mental health setting, and maybe some of these things aren't necessarily talked about. So to have that reminder every now and then.
Definitely.
I really appreciated hearing about the different definitions of trauma, because I'd heard about acute trauma, but I hadn't really heard about those before. So that was pretty interesting. I also appreciated the idea of like trauma stewardship, and really how in many ways that seems like another form of like self-care as clinicians. And I think that's something that gets so often like neglected from these conversations about how we're going to be better able to meet our clients where they're at if we're taking care of ourselves. So yeah, very thought-provoking.
Yeah, thank you. Absolutely. It's definitely like our responsibility to acknowledge that and to take those breaks, because we're only serving ourselves, right? And in turn, by serving ourselves, we're also serving our clients and being better practitioners. So great.